We're going to talk about the alimentary canal and digestion and absorption. So the alimentary canal basically is a fancy word for our GI tract. It includes the oral cavity, the pharynx, esophagus, stomach, small intestine, large intestine, and sometimes they'll even include the anus and the rectum. So it's basically from the mouth in to the bottom out. It's approximately 30 feet long. The small intestine has 3 segments. The duodenum is the top section, the jejunum, and then the ileum. And then the large intestine is the cecum, colon, and rectum. The accessory organs to our GI tract are salivary glands, the liver, the gallbladder, and the pancreas. In your book, I really like this picture. It shows you exactly what happens at each of these stops. So in the mouth is where obviously we chew our food or masticate. We swallow. Remember, salivary amylase is there and it's helping break down carbohydrates. But it's very important to chew our food and break it down into small particles so that it'll allow for easy digestion. The salivary glands not only produce the digestive enzymes, but it gives everything that moisture so that you can swallow easily. The pharynx helps prevent our food from entering our lungs, so it keeps it so that we don't choke. And then the esophagus is the tube that's going to transport our food through peristalsis, which is an involuntary rhythmic contraction, to the stomach. Now, gravity also plays a role in that, and that's why you should always be upright when you're eating. It's not good to lay down when you're eating so that you can properly digest your food. Once that food gets to the stomach, it mixes with hydrochloric acid in the stomach and different enzymes that'll aid in digestion. It kills harmful microorganisms. It becomes a mixture that's called chyme now. And there's limited absorption in the stomach. The pancreas will produce bicarbonates to neutralize that stomach acid and secrete several digestive enzymes and insulin that will help regulate our blood glucose. This is where diabetics have a problem. Either they're not producing insulin or they're inefficient at producing insulin. So that makes the difference between type 1 and type 2. Then we have the gallbladder, which stores and secretes bile, and the liver regulates any biochemical reactions, filters harmful substances, as we know, like a lot of medications, alcohol, are filtered through the liver. So you have to be very careful about that and aware of that, because that can cause damage to the liver if it's abused. The liver is also a place where most of our fat-soluble vitamins and minerals are stored, and it helps in the metabolism of our macronutrients, so our carbohydrates, our proteins, our fats, and it synthesizes proteins and produces bile, which can emulsify the fat. Then it'll pass into the small intestine, which completes the digestion by enzymes and that bile that's placed into the system at the duodenum. Absorption of the majority of our nutrients occurs in the small intestine. We'll talk more about that as we move through this PowerPoint. But we go small intestine, then large intestine, and at the large intestine, water is absorbed from that product. And some ions, it forms and stores the feces, and then it is held in the rectum until it's expelled through the anus. There are 2 types of action when it comes to digestion. We've got our mechanical, one of which is voluntary, and that's chewing or mastication, and the other is involuntary, which is that peristalsis, which is that rhythmic contraction that just happens within our GI tract. We've also got chemical digestion. That's where our enzymes and those digestive juices, like the hydrochloric acid in our stomach, reduce food to more absorbable molecules. There's a chemical action too on water, so hydrolysis. This is a reaction in the digestive tract that allows the nutrients in food to be utilized. These enzymes will also break down, like I said, the proteins, the fats, and carbs. So we've got proteases, lipases, and amylases. So they'll break protein down to protein and water, and then into amino acids, and so forth. The wall of our gastrointestinal tract is similar to from all the way from the esophagus out through the rectum. So it's that similar tissue, and it all kind of practices that involuntary rhythmic contraction. There are valves, or what you may hear called sphincter muscles. These are designed to retain food in each segment as it passes through the GI tract until the completion of those mechanical actions in that segment are complete. So it'll allow measured amounts of food to pass into the next segment and prevent it from backing up. Now, when you hear a patient complain of reflux or GERD, what's happening is their lower esophageal sphincter is not working properly. It's allowing some of that gastric juice and food to back up into their esophagus and can cause a burning sensation. So sometimes that can be a problem. This image kind of shows you the small intestine. The small intestine has these little villi and then microvilli within the villi. So what the purpose of those villi are for, like I mentioned, the majority of our nutrients are absorbed in the small intestine. All of these villi and microvilli increase the surface area to make that small intestine more efficient at absorption and also moving things through. So as far as our food choices, they can be influenced by 3 sensory perceptions. We've got sight. We see something and it looks good. We smell it. Approximately 75% of flavor comes from what we smell, and then we taste it. Our oral cavity is our port of entry, and once our foods go in the oral cavity, we've got receptors for taste called taste buds, and they consist of 50 to 150 cells, and that they are termed papillae. This is what a taste bud looks like. I believe this is in your book too if you want more detail on that. So there are nerve cells in the oral cavity that will carry those messages to our brain that will say, that's really sweet, or ooh, sour, salty, bitter, and umami. So food will stimulate those taste buds. Aromas will stimulate the olfactory nerves in our nose. As we get older, that decreases. A patient's ability to smell decreases. That's a complete loss of smell is anosmia. Gustatory is taste. Sometimes they don't have the taste either, because if you don't have the sense of smell to the extent that you used to, you're not going to taste as much either. So this can become a problem because older people tend to choose things that are sweeter, saltier. They need more taste to be able to enjoy their food, which oftentimes makes those foods more harmful to their teeth and their oral cavity. We've talked many times about xerostomia. This can happen as we age too, not only just from a decrease in salivary production, but when we add in all the medications that many of our older patients are on that cause xerostomia, that's an added problem. Iatrogenic is an adverse condition that is resulting from medical treatment. So that could be maybe a patient that's undergoing radiation therapy or chemotherapy or medications like I just mentioned that they've got them on. Anything that we cause to our patients is called iatrogenic. Hypogeusia, hypo meaning low, is a loss of taste. Hypergeusia is a heightened taste acuity. That doesn't always mean it's a good taste. Sometimes it's metallic. Sometimes it's a bad taste in their mouth, and that can be from medications or it can be from systemic health conditions. Anorexia nervosa, is what we think of when we typically think of anorexia. That's the person that has a distorted view of themselves and they don't eat and they're super, super gaunt and thin. Anorexia is not always anorexia nervosa. There are patients that exhibit anorexia due to a lack or a loss of appetite, which can be loss of a spouse, medications, illnesses. So anything that results in an inability for that patient to eat can be termed anorexia. It doesn't mean that they're concerned about their physical appearance, like anorexia nervosa. The saliva has many, many functions. So it's very important for lubrication of our oral tissues, for chewing, swallowing, and digestion. The oral clearance that it provides and getting those things out of our mouth so that they don't cause breakdown or demineralization to the tooth structures is important because it removes the debris and microorganisms that are present. It also provides an antibacterial action and buffers or neutralizes some of the acids that we get in our diet. It can also contain calcium and phosphorus and can lead to remineralization in some cases. It can prevent plaque accumulation, just like I said, because of the natural oral clearance that it provides. It facilitates taste and it promotes an ease of speech. If you've ever tried to talk for any length of time, your mouth gets dry and it's almost impossible to move your lips anymore. Remineralization, I just mentioned as far as saliva. What remineralization is where small amounts of enamel and dentin have started that breakdown or that demineralization process, but it is arrested or stopped by the minerals in our saliva, like calcium or phosphorus, or it could be caused by the use of a remineralizing dentifrice, like enamelon, or some of those pastes out there that are geared just for remineralization. Demineralization is where the calcium and phosphate and some of those minerals are lost from the tooth enamel. So this gives us a negative calcium balance, which increases the susceptibility to the resorption of that bone. Digestion is facilitated by the increase in surface area, which occurs with our teeth through mastication. Very important to crush and grind food into small pieces. Mom always told us to chew our food, 25 times, and there's a reason for that. So alveolar bone supports our dentition. It is cancellous bone or trabecular or spongy. And if you look at this image, if you took off that compact bone that covers the maxilla, this is what you see. And that is trabecular or spongy. It looks like a sponge, and all of those holes and spaces provide areas for nerves, nutrition, blood vessels to travel. The alveolar process is made up of both the maxilla and the mandible. And this is a very familiar picture. Surely you guys have seen this. Just showing you the different levels and layers of the tooth. The esophagus, there is a swallowing reflex within our esophagus that helps move the bolus of food. A bolus of food is just kind of a ball of food to the stomach by peristalsis and gravity. And then, like I said, there's that lower esophageal sphincter, which has some strong circular muscle fibers at the top of the stomach at the base of the esophagus. So the bolus passes to the pharynx under voluntary control, and then from that point the process becomes involuntary through peristalsis and gravity. And this is what this might look like. If you look at that area where the esophageal sphincter is located, you can see that it's closed. And in some people, it does not close all the way, or it flaps open easily. So that's what can happen. And then all the gastric juices and food and chyme can back up into that esophagus and cause a burning sensation. You can even, over time, end up with cancer. Esophageal cancer can be caused by that. So once that bolus of food enters the stomach and is mixed with those gastric secretions, it is now called chyme. The low pH of our stomach can help. It kills or inhibits the growth of food bacteria. So, you know, if you're at a picnic and the food's been sitting out too long, some people would get sick maybe, some won't, and it kind of depends on the pH of your stomach and how badly tainted the food is. So that low pH will also denature proteins and help break down the proteins into those amino acids that our body needs. It activates gastric enzymes. It hydrolyzes the carbohydrates and increases solubility and absorption of calcium and iron. Some of the major enzymes that we see in those gastric juices are pepsin. Pepsin is capable of hydrolyzing large protein molecules into smaller fragments. And then the gastric lipase is involved in the digestion of short and medium chain triglycerides, which are fats, hence the lipase. Normal gastric secretion is regulated by nerves and hormonal stimuli. And once we take in food, that food will stay in an adult stomach about an average of 3 to 4 hours is the holding time in the stomach. It then travels to the small intestine, where most of our energy providing nutrients are completely hydrolyzed and absorbed within the small intestine. It is approximately 15 feet long, so it's a pretty long organ. And foods will be retained within the small intestine for 3 to 10 hours. It performs tasks with the juices that are secreted by those accessory organs and its complex luminal wall. In the picture I mentioned the villi and the microvilli. Those are those finger-like projections on the inner lining of the small intestine. The villi are covered with these minute little hair-like folds called the microvilli that also help increase that surface area for absorption. We have bile that's then produced and secreted by the liver and stored in our gallbladder, and it aids in the emulsification of fats, or the breakdown of fats. And then pancreatic enzymes will enter the duodenum, which is that first section of the small intestine, which will help hydrolyze and break down proteins. It is produced in and stored in the pancreas in its inactive form. Other factors that could affect our digestion and absorption could be the amount consumed, the physiological need, the condition of our digestive tract. You hear of people that have Crohn's or diverticulitis or anything like that that can affect the function and the ability to absorb nutrients in that digestive tract can be a problem. The level of our hormones that help in this process. Nutrients or drugs that are ingested at the same time can either enhance or interfere with absorptions. There are some things that will aid in our ability to absorb things, and then there's things that will allow our body or not allow our body to absorb. And then we need adequate amounts of those digestive enzymes. That absorption can happen through passive diffusion, which is the passage of a substance from a more concentrated solution area to lower. It can be absorbed through active transport, where there's a region of lower concentration to an area of higher concentration, which requires a carrier and it requires energy because you're kind of going upstream. You're going against the grain. And then osmosis is the passage of a liquid through a semi-permeable membrane, and that's going to equalize the pressure of the ions on either side of that membrane. So 80 to 90% of the fluid in our body is absorbed this way through osmosis in the small intestine. Most nutrients are absorbed through the mucosa of the small intestine, and from that point, they then go to the portal circulation. Portal means liver, so they go into that portal circulation where nutrients from the GI tract and spleen are absorbed into the bloodstream and liver via that portal vein. Metabolism is then initiated by the liver. Absorption of fat-soluble nutrients is complex. Molecules are large and insoluble, so they have to be kind of broken down, and we talked about the bile in the liver emulsifying those fats, and that's basically what that's doing. The lymphatic system is composed of lymph nodes, and lymph vessels, which are not connected to the blood system. The absorption of fat-soluble vitamins is not as complex as the absorption of long fatty acid chains. The bile salts and lipases increase their water solubility, and this enables absorption of these vitamins and other fats into that lymphatic system. After the small intestine, things will pass to the large intestine. And I've mentioned before, some books will say that the large intestine is where the largest amount of absorption occurs, and that is just not true. Only about 5% of ingested foods and digestive secretions continue to the large intestine. For most adults, it takes 16 to 24 hours for food to travel that full length of the gut and end up down at the large intestine. It has little to no digestive function. Everything's kind of been, the nutrients have been absorbed. The purpose of the large intestine is to reabsorb the water from the waste and the electrolytes needed to form and store residue. So basically it's kind of pulling the water out and forming the feces, which is more of a firm, more solid form of waste. The inner lining of the intestine does not have the villi like we had in the small intestine, which enabled that absorption of nutrients. It's more smooth to allow for this waste to pass. There are undigested residues that will end up in the large intestine. So dietary fiber is often recommended for people with diarrhea or constipation. Dietary fiber is not digestible. It works as a laxative. So that's going to be something that's going to result in increased transit time. So fiber will increase the residue and has water holding capacity, or it bulks up the fecal matter. The residue will stimulate that peristalsis and result in improved muscle tone. There are microflora that are naturally occurring in the large intestine. Trillions of harmless microorganisms that thrive in the intestine. And this really occurs in many areas of our body. And as you know, when we take antibiotics, that can mess all of the microflora up. So that's another reason we have learned that it's better to be somewhat cautious with antibiotic use, because it kind of throws off the whole microflora of the body. These microorganisms are important for breakdown of substances that enzymes cannot digest. They synthesize vitamins. They can help make, I know, vitamin K, and there are some B vitamins that can be produced by these flora. They boost our immune system, and they inhibit pathogenic bacteria. So the good bacteria is kind of protecting us against the bad bacteria. So an imbalance of intestinal flora can affect our overall health, and it can affect our mood, anxiety, memory, and even concentration. This is just a chart that kind of shows you the different things that can affect our intestinal balance. And our intestinal balance can affect our immune function, our metabolism, and our digestion. So a few of the things I mentioned were medications or antibiotics, our genetics, our diet, probiotics, that's a big thing. A lot of people are trying to make sure they get plenty of probiotics to keep regular and keep that intestinal microbiome level. Bacterial exposure, our immune system can affect that, stress, and our environment. What are probiotics? We hear all about that. They are living organisms that provide health benefits to our body or the host when present in adequate amounts. They are considered food or dietary supplement in the U.S. Many consumers are confused by them and don't really understand how they work. I would recommend that you do a little research if you are going to take probiotics and find out exactly what you should or should not take. They are all made up of different bacterium. So there's a genus, a species, and a strain that make up these bacterium. So example, a genus would be like the lactobacillus. And then gives you food sources, yogurt with active cultures, tempeh, miso. The habitat, where are they normally found? In your urinary tract, the GI tract, female genitalia. And then it gives you the common species or strains, which usually gives you a number. It'll give you that it's a lactobacillus acidophilus W37. That's just giving you the specific bacterium. There's issues with quality of probiotics. Research is still expanding, and they're trying to understand health benefits of these probiotics. So they're kind of they're not new, but they're constantly trying to improve and understand how exactly they work. Prebiotics are non-digestible food ingredients which are beneficial for the host. They kind of almost provide the fuel or the food for the probiotics. Again, just a chart kind of showing you how that works. Probiotics in the middle, some effects, diarrhea, antibiotic-associated diarrhea, inflammatory bowel disease, irritable bowel, lactose intolerance, and then it kind of gives you the strain, the species, and how widespread that could be. Peristalsis, like we said, in the large intestine, that is that involuntary contraction again, and it's going to move that fecal material into the rectum. Constipation is a common problem for many people. It's something most people don't talk about, but it is more common than you may think. It is defined as having a bowel movement fewer than 3 times per week, and when you do, the feces are hard, dry, small, and difficult to pass. So for people that would like to go more than once a day, or maybe they're only going every other day, that's not necessarily constipation. It is defined as having fewer than 3 times a week.